we're hearing of this surge in dengue cases locally, a lot in Region 6. We're hearing now of the surge even in Region 4. Haven't been hearing a lot in terms of any public service announcements out of the Ministry of Health. How do you manage this outbreak, as it were, and we're now kind of easing out of COVID, now we got dengue to consider. What are your thoughts on the spread of dengue locally?
Thank you very much for having me on your program, Sherrod, MP. As I alluded to or I mentioned in my article just a few days ago, to bring public awareness to the state of affairs and the public concern of this dengue virus. As you rightly say, it's not only in Region 6 or Region 4, but it's 70% of our regions. 7 out of 10 of our regions, developmental regions, we have the dengue outbreak. And I think it's a public health concern, and I'm wondering if we are in any way, or what's our status in terms of if there's a real public health crisis, if we can handle it, you know. As you know, the Minister of Health would have said about 8 weeks ago, we have close to 3,000 cases. And you know, when you say 3,000 cases, you have to multiply that by 3, because not everyone would go to the health center or the hospital to have a test. And so out of those 3,000 cases, thereabout, 300 cases of those cases, persons have been hospitalized, you know, and there are about 3 deaths. You know, so it is a cause of concern how many more deaths you want, or how many more hospitalizations before something, you know, desperately is done. We know the disease or the virus, the symptoms are more apparent in adults, less apparent, clinical apparent in children. And of course, it ranges from fever, high-grade fever, about 40 degrees Celsius, to rash to the limbs, nausea, retroorbital pain in the back of the eye, what else? Muscle pains, you know, there are about 5 symptoms of the cough, you know. And of course, if you reach a stage where you have gotten hemorrhagic fever, where there's a lot of bleeding and you're vomiting blood now, and your blood in the stool, well, that's a cause for concern. But certainly these are preventative. It is preventative, then it's preventative, and so we need to go on the preventative aspect, or, you know, stress on the preventative aspect, you know, of this condition. And so at the macro level, I think more can be done at the macro level in terms, there must be ongoing, as you had mentioned earlier, public health attention to prevent before any more escalation. They must have consolidated measures of vector control. In fact, all hands should be on deck. We have a beautiful system here in Guyana where you have at the central level, the regional level, the municipalities, you have the NDCs. So, and in all of this tier, in these tiers, you have environmental officers. And so, you know, it's just to have intersectorial engagement and meetings, and so that we can pave the way forward. And so I am a little concerned, a little disappointed that has not been done. It just goes like it's just business as usual. Until someone of your relative would come down with it, then there's a cause for concern. So we must reduce the kind of scale and the impact it would have, you know. So as I said before, at the macro level, we need to do more vector sector, you know, more surveillance, monitor. You know, we have this One Health concept, monitor the One Health concept. In terms of legislation too, we may have to look at the urban, I mean, we're building houses left, right, and center. But what are the regulations? You know, it has been said that we don't really, some persons don't follow regulations. You know, it's yes, in court, yes, we do this, but in action, we don't always follow the regulations. And so you have to look at housing policies and land use regulations, which I think is a cause for concern. We need early warning systems. I mean, we have the meteorological department. I'm not sure if health and meteorological department, if there's any consultations, you know, because they're the ones who know what's happening, global warming, you know, increase of fossil fuels, we know the temperature is rising, but we need to know where the places and the locations, you know, the spatial distribution of these mosquitoes and so forth. So it's doable. It's just to sit and to have sensible discussions. as to the way forward.
I was about to ask you, how is it transmitted for those who may not know, because we've talked a little bit about the symptoms, we talked a little bit about the preventative measures, but in terms of spread, I was on the seawalls quite recently. A lot of mosquitoes out there. I learned from colleagues at the region, this is the RDC4, Regional Democratic Council, Region 4, they said we have 2 fogging machines and they have been down, up and down, up and down. So mosquitoes is the primary way in which dengue is spread.
That's right. So you have to find out where the habitats are, and so you could able to do, do larvicidal and to kill the mosquitoes of themselves. There are chemicals that you can use, organophosphate, different things chemicals that you can use to kill the mosquito itself. But it's when the mosquito bites, it's an infected mosquito, female mosquito that bites, bites the person, and then it goes into its stomach, the gut, and goes all around the bloodstream, so it bites you. And so within, there's the incubation period in the mosquito itself. I think it's 8 to 12 days of the mosquito. So there's a host, the mosquito, you are the host as well as the mosquito. So there's a cycle for the mosquito as well as you, as the human part, And so for us it's about, I think, 5 to 6 days for the incubation period from when you have the symptoms, so the disease.
Yeah.
The bite to the incubation period, the incubation from the bite to when you come down with the symptoms and so forth. So at the mosquito level, things can be done, and at the human level, of course, your repellents and your mosquito insecticide, mosquito nets can be used as well, And so, of course, these stagnant, drains, of course. And I want to put in a little bit for the systemic economic inequalities, and that could cause, poverty, and so, the areas, people don't have proper homes and those sort of things. And children, malnutrition, these are the ones more vulnerable and at risk, So economics play a part as well,
Correct.
So we talk about economic injustices here. And so we need to think about that as well.
Part of what you talked about too is the fact that the symptoms are easy to recognize in adults than in kids.
Yes.
What I wanted to ask is, you have dengue. How do you? Does the management of dengue?
Well, the truth is it's self-limiting in that by itself it goes away. When it depends on your immune status and all of that, and then if it bites and you don't have, as I said before, the economics, you don't have nice vitamins and minerals, and your diet, basically diet. If you can't afford that, you're more prone, more susceptible. But like everything else, if you try to use your repellent, try to, with the fogging machines, if they help in these areas that's well known. And of course, as an individual, your repellents and your mosquito nets, that should help to survive. And of course, you don't want any stagnant drains. You want to keep it's basically hygiene. Long ago, we had no problems. You recall, and if you were born long enough, we have these guys came with a brown uniform, spray your place, and they actually put a seal when they're going to come back and all of that. But that has been broken down.
Yeah.
Those measures have been broken down.
We had it in the back door of our home.
That's right. They will come. You see them spraying the septic tank, the different places that the tires and so forth. We haven't seen that for some time now. We haven't seen that. So simple public health measures that can be done, that's doable, that can be done, that it's not being done.
Anything else you wish to add, Dr. Cummings, on this issue of the spread of dengue locally?
Well, basically, as we know, climate change has to be part of the equation, and so we have to, our healthcare workers have to be trained as to the nexus between climate change and health. And we see all the increase in rising temperature causing a lot of flooding, a lot of droughts, El Nino, as we know, and so on. So when you see these persons coming in the interior, in the regions, you have to be alert as to what some of these diseases that are trending, and topical diseases. So topical and tropical disease, topical issues and tropical diseases. And so I just want to tell the public that they need to be careful. Of course, you need to like yourself. You have a part to play. It's everyone, all hands on deck. The ministry has a part to play. The regional, at the regional level, the NDC level, and you as a in the community and individual. Especially if you're an influencer, you need to let persons know that they need to, hygiene and keep the surroundings clean, environmental clean. Cleanliness is certainly next to godliness here, and you can prevent dengue fever.